First of all, a very warm welcome to you. I'm so grateful. I know how incredibly busy you are. I just interviewed James Nestor the other day, and he was talking about how you're booked up 18 months ahead of time. And so I was like, I can't believe I'm getting the chance to talk to you. So thank you so much for coming.
Sure, of course. It's been it's been an interesting 2 years. Something
It
that
sure
was
has.
breathing, we've been on this radar for about 20 years, and the last 2 years has just been absolutely incredible. So it's been great. It really is getting out there. All I have to do now is manage time a bit better. Other than that,
you have to basically become a master of like managing all the timings, right?
Well, that's an important part of it.
And tell me, Patrick, one of the things I just introed with is when I read your book, you were like, there's this whole myth, take a big deep breath. And it's something I always told my class to do. And then you were like, no, we shouldn't be telling people to take a big deep breath, for example, at the beginning of a class. Please, can you expand on that? Because I think that's going to be a big paradigm shift for a lot of us.
Yeah, like a deep breath just means that we're using the diaphragm. We have optimal amplitude of the diaphragm. And typically that's harnessed when we breathe in and out through the nose. Oftentimes you see people maybe not differentiating between nose and mouth breathing. You cannot achieve optimal amplitude of the diaphragm if you're mouth breathing. So it's very easy for people to check. All they do is look down at their chest, breathe through their mouth, and they'll typically see that it's moving the upper chest more than the lower. Now, I think the interesting thing here is that many people believe that the more air you breathe, the more oxygen that's delivered throughout the body. And we have to turn that one on its head. And this is what I came across by accident after reading a newspaper article about the work of Dr. Konstantin Buteyko back in 1997. I always had cold hands and feet. And it was when I practiced breathing less air, and this was the opposite to what most people tell you to do, that I started to notice that the temperature on my hands was improving. And I never realized, Celeste, that I was a chronic mouth breather, an upper chest breather, and fast breathing. And so I had a dysfunctional breathing pattern. And it's your everyday breathing then, which would of course influence your breathing during sleep. And if you were, say, practicing yoga, I wasn't practicing yoga, but yoga, even for people trying to do meditation. And we have to get back to the basics here. A couple of things about it. Number one is that breathing is deeper than just take that deep breath, that there's actually 3 dimensions to breathing when we work with somebody. So when I'm working with a student, we look at breathing from biochemical point of view, which is focused on carbon dioxide in the blood, biomechanics, which is focusing on lateral expansion and contraction of the lower ribs, and resonance frequency breathing, which is in terms of the optimal cadence or number of breaths per minute to help influence the functioning of the autonomic nervous system. Now, it's taking that 3 dimensions of breathing and then bringing it into everyday life. And yoga has such a tremendous capacity here, because how many people are attending yoga to help deal with sleep problems, mental health problems, high stress, anxiety? And also people, I feel that they often veer towards yoga when they don't like gyms. So it suits that group of people. They don't want to go to a gym, but at the same time, they want to do something that's actively engaging body and mind. And imagine what could happen if a yoga instructor were saying to their students coming in, now we're going to give you a different breathing exercise to improve your blood circulation. How? By getting the students to breathe a little bit less air during the movement. That's all. In and out through the nose, and slowing down and reducing breathing volume to increase carbon dioxide a little in the blood, which gives you the feeling of air hunger. But also, when we come back to, so that's in terms of blood circulation, but also oxygen delivery is based on the presence of carbon dioxide. And then the yoga instructor is focusing on breathing low, nasal breathing with good amplitude of the diaphragm. And then to bring in slow breathing to improve gas exchange, but telling the student what's happening. So when somebody comes into me with anxiety or panic over the years, And if we look at the anxiety and panic population, 75 to 80% of them have dysfunctional breathing patterns. 75 to 80%.
Wow.
Now, can you imagine if they were going into a yoga studio and the yoga instructor was improving their functional breathing, not just from a biomechanical point of view, but from a biochemical, biomechanical, and resonance frequency point of view, but also giving them then this exercise, this information that they can take it home. Because I'll give you another example. I was chronically exhausted for many years, and going into school and going into university, and you have to concentrate, you have to be able to hold your attention on doing what you're doing. I didn't have that. I had undiagnosed obstructive sleep apnea, and sleep disorder breathing is very common throughout the Western world. And if you have somebody attending a yoga studio for anxiety and panic, we also need to look at their sleep. And it's taking that breathing out of the yoga studio, away from the mat, into everyday life. So how should the person breathe when they're asleep? It should be in and out, and it should be light, slow, and deep. And I use the acronym LSD. And then there's other aspects of it.
I love that.
Female breathing.
We're going to get high on some LSD today, guys. Are you ready?
That's high in your own supply.
I'm so going to use that,
that's
by the
not
way.
my words, but that's Wim Hof. But at the same time, you know, female breathing is different to male breathing, and this has been known since 1905.
Oh,
So
really?
say, for example,
how is it different? That's really interesting.
Younger females during the monthly cycle, days 10 to days 22. So it's mid-luteal to mid-follicular phase. There's an increase in progesterone. There's an increase in estrogen. Progesterone is a respiratory stimulant. Breathing becomes faster, maybe more likely upper chest. And as a result, carbon dioxide, if breathing becomes faster and harder, carbon dioxide levels can drop by as much as 25%. This increases pain perception. This lowers pain thresholds. It contributes to fatigue, anxiety, and a feeling of breathlessness. Now that's going to affect performance of the female. So I wrote, I didn't mention to you, I wrote a new book called The Breathing Cure. And we had it was published there about a month ago. It's a big one. It's 190,000 words, but it's looking at topics in breathing, but bringing the science together. And it consists of 26 different breathing exercises. I put in 2 chapters for females.
Wow.
One, you know, even bringing in sleep disorder breathing with postmenopausal women. And okay, sleep apnea and snoring affects more men than women. But when the female transitions beyond menopause, so post-menopause, the risk of sleep disorder breathing can increase by 200 to 300%. And again, that doesn't get discussed. So despite, can you imagine all of the people who were attending yoga, so many female population, and yet the information about breathing being different has not got out there. And the reason being is because most research done on breathing is done by men. And even when they do research on females, they fail to take into consideration the monthly cycle. So it's strange.
But it's so, I mean, just empowering and exciting about the work that you are doing, because actually you are bringing this into the mainstream. And what's so wonderful about the community I'm surrounded by is they are so hungry for this information. And when I first told everyone about your first book, so many people wrote to me going, thank you so much for the suggestion. It's like totally transformed. And so I think everyone watching right now is very excited. Your next book's called The Breathing Cure.
Yes, it's out. I'm writing a new book now as well on attention and focus and concentration.
Oh, I need that so bad. That's so good.
Can you think of how many people actually need that so bad? The Breathing Cure was an interesting one because it's purposely a big book. And it was just because sometimes I think that people think that breathing is something that's on the fringes, or it's not something that everybody should be doing. It's absolutely so vital. You know, and I wrote on the back cover, it's through the breath that you can influence all of the major disciplines of medicine. Sleep. I had an article published in the Journal of Clinical Medicine, 10,000 words, looking at the application of breathing for sleep apnea. And 43% of the male population over 50 years of age are prone to sleep apnea. And I would say to any of your listeners, if you're sleeping with your mouth open and waking up with a dry mouth in the morning, you're not getting that deep, deep sleep. And sleep is huge. It's absolutely vital for recovery, and it's vital for calmness of the mind. So, it's been an interesting one. The book will be out in the United States in July or August of this year, but it's out in the UK and Ireland at the moment, and it's going into different
Perfect. I'm
languages.
going to
So,
get it as soon as we're done on this call, because I'm very excited to read more, because it's been such a game. Oh, you sent me one.
Oh, did I send it to you? I don't know.
Yeah, I think you asked me to send you my address, and I never did. I'm going to buy it because I want to, I'm also an author, and I think it's important we support each other. Cool. But what I wanted to say, Patrick, is when I read your book, it was such a game changer for me, and I started implementing some of the tips. And one of the tips was increase your breath holding score. I mean, mine is so low, and I'm struggling so hard to get it up. Please give us some tips. I know someone else just in the comments has written the same concern. Have you got any help or advice you can give us?
Well, your breath hold score is going to be influenced by a number of things. Genetics play a role, lifestyle, stress, hormonal changes are going to play a role. And to improve breath hold time, it's about bringing in light breathing throughout the day, doing physical exercise with the mouth closed, but even practicing something like this. You have one hand on the chest, one hand just above the navel, taking attention out of the mind onto the breath, and really focusing on the slightly colder air coming into the nose and the slightly warmer air leaving the nose. And as you're focusing on your breathing, gently slow down the speed of the air coming in and out of the nose, and slow down the speed of the air to the point of air hunger. So you're taking a very soft and slow, gentle breath coming into the nose, and a really, really relaxed and a slow, gentle breath out. Now, this is likely to be a shallow breath, but the whole purpose of this is to breathe less air. What happens when you breathe less air? Let's investigate this, because most people say breathe more air, and I'm saying don't, because many people are already over breathing. We need to bring their breathing back towards normal, not to teach them to breathe more air. We need them to to breathe less air. So by focusing on this, you're focusing on the slightly colder air coming into the nose and the slightly warmer air as it's leaving the nose, and really slowing down the speed of your breathing. Very soft and slow, gentle breath in, and a relaxed and a slow and gentle exhalation. Slowing down the breath, quietening the breath, and calming the breath, and simply slowing down the speed of breathing by taking less air into the body to the point of air hunger. So, you're doing it correctly when you feel air hunger. And air hunger signifies that carbon dioxide has increased in the blood. So that air hunger is interesting, because as carbon dioxide increases in the blood vessels dilate. And as carbon dioxide is increasing in the blood, hemoglobin releases oxygen more readily. And for people to experience what is happening when you have the air hunger, can you influence the blood circulation in your hands? As you're having air hunger during the breathing exercise, do you notice any change in saliva in the mouth? So, for example, increased watery saliva is a signal that we've stimulated the vagus nerve.
Yeah, I just got that, actually. That's amazing.
Slow breathing that stimulates the vagus nerve, but increased carbon dioxide, there's a vagotropic effect. Now, I suppose most of the science in the last 20, 30 years, Celeste, has all centered around heart rate variability, baroreflex, sensitivity of the baroreceptors, etc. Through the breath, we can influence that by breathing light, and that's by breathing less air to the point of air hunger, by breathing slow to a cadence then of between 4.5 and 6.5 breaths per minute, and by breathing low with optimal amplitude of the diaphragm. And it's not that we want to be doing all three dimensions together. Like normally when I work with students, I'm working with students from a breathing light perspective, first of all, and I teach them their breathing from a biochemical point of view. And then bring in breathe low, how to optimize or improve amplitude of the diaphragm. And then we bring in breathe slow. So we focus on each dimension and then we bring it in together, because sometimes if you focus on all three at once, it's too much for people. And I suppose to realize that breathing is traditionally being taught according to tradition. And when we are taught according to tradition, we are normally taught according to only one dimension of breathing. So my background with Buteyko was focused mainly on the biochemistry.
Yeah.
And if I talk with a yoga instructor, they're focused maybe solely on the biomechanics.
Yeah.
And then somebody from a heart mat point of view are focusing on primarily resonance frequency breathing. But this is where there has been a disconnect. And it's like three-legged stool. We can't just have, if it's the stool has two legs, it's not going to stand up in itself.
No.
And there's an overlap between one dimension and the other. So coming back to your question, to improve your BOLT score or to improve your breath hold time, and your breath hold time is a good indicator of functional breathing patterns. And there was a study carried out by a professor of physical therapy, Kyle Kiesel, and it was published in 2018. He looked at 51 individuals and he looked at their breathing across a number of dimensions. And he concluded that the easiest way to screen for breathing pattern disorders is to simply measure breath hold time. And the breath hold time is as follows: the same as the BOLT score, same as the control pose in Buteyko. You take a normal breath in and out through your nose, you pinch your nose and you hold your breath, and you're timing it in seconds until you feel the first definite desire to breathe. So you keep on holding your breath until you feel the first definite desire to breathe, and then you let go, you breathe in through your nose, but your breathing should be normal. Now, his conclusion was that if the BOLT score, if it's greater than 25 seconds, there is an 89% chance that dysfunctional breathing is not present. So if you go beyond the first definite desire to breathe, obviously you've gone too far. So you've gone a small bit too far there. But it looks as if your BOLT score is pretty good.
I mean, it's getting a bit better. Let me be
Sure.
totally honest with everyone watching. It was so low when I started reading your book, so low. But I'm forcing myself to do cardio training through my nose.
Yes.
Which has been so humbling.
It's difficult. Yes.
I mean, it wasn't pretty, all the stuff that was coming out of my face.
Yes.
It was like cerebrospinal fluid leaking out of my nose. And the other thing that was happening was I was having to scale back on intensity. So for my ego, I was not feeling good about that. But in general, I would say, and the other thing that I was doing is I've been trying to walk holding my breath, but I can only get to 20, 25 paces and then I'm half dying.
Yeah, and these are interesting ways of improving your BOLT score. So for example, it's doing the breathe light sitting down, doing your physical exercise with the Mckeown. Like, I suppose when we consider what does the human mouth do in terms of breathing, Celeste, is there even one function performed by the human mouth of the air coming into the lungs? Does the mouth warm the incoming air? Does it moisten? Does it filter? Does it regulate volume? Does it harness nasal nitric oxide? Does nothing.
No.
It has no function whatsoever. The mouth is simply a hole, and it's a hole whereby air can come into the lungs. And how many people do their physical exercise with their mouths open? It doesn't make sense because they're breathing fast. What about
like sports people? Because since I read your book,
yes,
I've been trying to preach to my boyfriend. This is falling on deaf ears.
Sure.
And so now whenever I'm watching boxing with him, because he likes boxing, I'm like, look, he's got his mouth closed. That one's got his mouth open. Do you think that we're just at the precipice of a massive wave of change that's going to come into professional sports and the world in general? And it's going to become more mainstream?
Something is happening. I think it's happening. I think at the moment it's still in innovators. I had 2 meetings this morning with football clubs. So it'll kind of give you an idea. It's starting to happen.
Okay, but amazing.
I'll tell you where it's happening now at the moment. More so is in the military and elite police forces as well. So a number of countries throughout the world are bringing in breathing exercises, and I think this is more so to regulate autonomic states, because if somebody goes into a stressful situation and if they're too ramped up, they're liable to make a mistake, and that is not good. Too much stress is not good. Yeah, so there's definitely something happening. Of course, there's some way to go with it, but it's coming back to that thing. Why breathe through an open mouth during recreational physical exercise when it reduces oxygen uptake in the blood? This is known since 1988.
Yeah.
The fraction of expired oxygen is greater with mouth breathing than with nasal breathing. So nose breathing, the body utilizes oxygen better. Nasal breathing, It reduces our sensitivity to the gas carbon dioxide. And as a result, then over time, that when we do our physical exercise, we do our physical exercise with less breathlessness. Nasal breathing is harnessing or is activating or engaging the diaphragm much better than mouth breathing. Nasal breathing, of course, is involving slower breathing, which is important for mental states. And diaphragmatic breathing is also important for mental states. Nasal breathing is protecting the entire upper airways and the lower airways. How many people have exercise-induced bronchoconstriction, asthma, problems with the upper airways, stuffy noses? And, you know, that's why it comes back to the nose. It really is. And it's about breathing in and out through the nose, not in through the nose and out through the mouth, but breathing in and out through the nose. The mouth does nothing for breathing. It's really starting there.
Awesome. And listen, something that I'm not sure, I mean, you're touching upon biomechanics as well. And one thing that I think is really prevalent, especially in the industry I work in, is the constant engage your core, engage your core, engage your core. And when I actually spoke about this in my workshop, I was met with a lot of resistance when I was trying to explain to people, you have to relax your core when you inhale. Please, can someone like you with way more knowledge and experience, can you expand on that? Because I feel like that is an area of massive growth for me and my colleagues.
Yeah, I wrote about this in the new book because, again, it's an area that has been kind of overlooked. And it's not just about training the abs. That when we think of the core, we should be thinking of it as a box. And you've got the diaphragm as a roof. You've got the pelvic floor. You've got the abs to the front. You've got the spinal muscles to the back. And it's very important that we have optimal breathing for optimal movement. And theorists have gone so far as saying that you cannot have functional movement without having functional breathing. And a good gauge of functional breathing is the generation of intra-abdominal pressure. And you can gauge this by simply having your hands either side of the lower ribs on the 9th and 10th rib. And as you breathe in, you should gently feel that the lower ribs are moving out. And as you breathe out, you should gently feel that the lower ribs are moving in. And as you breathe in, the lower ribs are gently moving out. And as you breathe out, the lower ribs are gently moving in. Now, by the way, this is deep breathing in the true sense of the word. You don't have to hear your breath. You don't have to take big breaths. You don't have to take full breaths. But it takes intra-abdominal pressure to push the ribs outwards. Now, intra-abdominal pressure is influenced by what's called the zone of apposition. And the zone of apposition is the distance from the top of the diaphragm after a normal exhalation down to the lower ribs. So, the exhalation, whereby the diaphragm is moving back up to its resting position, in turn is influencing the zone of apposition, but also the expiration is influencing the inspiration. So we have to have a normal and complete exhalation with the diaphragm moving back upwards. And then when carbon dioxide increases in the blood and the brain sends the message to breathe, the diaphragm is moving downwards by about 2 to 3 centimeters during rest. The intercostal muscles are pulling out. The volume of the thorax is increasing. The pressure inside the chest is reducing. And as a result, air comes into the body. And functional movement and functional breathing go together. And as far as one study looking at the functional movement screen, I know some people are a little bit critical of it, but use any screen. 87.5% of people who've passed the functional movement screen were diaphragmatic breathers. Now, again, when we look at the pockets of the population who have dysfunctional breathing, 50% of people with lower back pain, 50%. Now, you could argue, is it the lower back pain which is causing dysfunctional breathing, or is it dysfunctional breathing which is feeding back into the lower back pain? We have to think that the diaphragm is not just for respiration, but it's also there for stabilization of the spine. And by teaching individuals to breathe through the nose, I think it's key, because if you think of physical therapists and physiotherapists and all of the occupations that work on focusing on the biomechanics, but the one thing that they can sometimes overlook is the importance of nasal breathing. If we have the mouth open, if we breathe through the mouth, we typically engage the upper chest and we have reduced amplitude of the diaphragm. So for the biomechanics, nasal breathing too is important.
Amazing. And a lot of people are also really curious to get your opinion. And I know this is a massive area of speciality for you, and you've helped so many people with asthma. people were like, can you give us some tips for asthmatics? How can we help this population?
Yeah, no, for sure. Like asthma was something that I was working with originally full time from 2002 onwards. Um, I really feel it's a shame that our asthma societies have not embraced breathing exercises. It just doesn't make sense.
It's
There's
crazy.
20 clinical trials, and I've been involved with 5 of them. No side effects from changing somebody's breathing patterns.
Like just give pumps, don't they?
It's
Because I
just,
because I trained as a
yes,
physio and we did respiratory health. And yeah, what were we prescribing? We were prescribing
yeah,
pumps to
yes,
people. It
yeah.
was like so backwards.
Celeste, it's a shame. And there's another thing going on as well, because if you have asthma and if you have inflammation of your lungs, it's not normally just isolated to the lungs. So since 2007, it's been recognized that it's actually one airway. So you're talking about the nose, the nasal cavity, the throat, the trachea, the bronchi, the bronchioles, the diaphragm, etc. All one airway, all interlinked. If we have inflammation in our lungs, it travels up to the nose and vice versa. But if we have a stuffy nose, we are 2 to 3 times more likely to have a sleep problem. So anybody listening with asthma or with hay fever, which is considered asthma of the nose, you don't just have asthma. You're more likely to be tired, to snore, and to have obstructive sleep apnea. Okay, so exercises to help with asthma, by far and away, start with nasal breathing. A very gentle exercise to start if you're getting any symptoms is to do small breath holds. And this exercise is also very important for calming the mind. If we think of people who are in a high stressful state or racing mind or anxiety of the mind, and they are instructed to do mindfulness, you cannot do mindfulness when your mind is racing. We have to be realistic. So for asthma, and also to calm the central nervous system, how can we do it with an easy technique? And this is as follows. Take a normal breath in and out through the nose and pinch the nose and hold the breath for 5 seconds. 5, 4, 3, 2, 1. Let go and breathe in through your nose and breathe normal for 10 seconds. So it's just normal breathing. We don't have to take any full breaths or anything afterwards. And again, take a normal breath in through the nose and out through the nose and pinch the nose and hold. 5, 4, 3, 2, 1. Let go, breathe in through the nose and to breathe normal then for 10 seconds. And again, take a normal breath in through the nose and out through the nose and pinch the nose and hold. 5, 4, 3, 2, 1. Let go, breathe in through your nose and breathe normal for 10 seconds. So you're just kind of breathing normal for 10 seconds. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold. 5, 4, 3, 2, 1. Let go, breathe in through your nose and breathe normal for 10 seconds. And again, take a normal breath in through your nose and out through your nose and pinch your nose and hold. 5, 4, 3, 2, 1. Let go and to breathe in. That's an exercise that could be started straight away. The first signs of symptoms, try not to give in to taking full big breaths. Do small breath holds to help open up the airways, but it also stimulates the vagus nerve. Like if we think of bringing the body into relaxation, it's all in the exhalation. But if we're in a state of panic or anxiety or asthma, we want to stimulate the vagus nerve, but we may not be able to slow down our breathing because the air hunger is too much. Instead, hold your breath. You take a normal breath in and out. There's your exhalation. But then you do a breath hold after the exhalation, which is like an extended exhalation. And this then is stimulating the vagus nerve, which is secreting acetylcholine, which is causing a slowing of the heart. And of course, this information is fed up to the brain, and the brain is interpreting that the body is in a safe environment and feeds back accordingly. An exercise to decongest the nose, and this can also help with asthma. And don't do this if the female is pregnant or if you have any serious medical conditions. So a very easy exercise. Take a normal breath in through your nose and out through your nose and pinch your nose and hold, and just gently nod your head up and down as you hold your breath. So you're just gently nodding your head up and down as you hold your breath, and keep holding your breath until you feel a relatively strong air hunger. and then you let go, and you breathe in through your nose. And this one you have to
I took this trick off of yours.
Yeah.
Because I saw it when I did loads of research for my breathing workshop, and when I saw you teaching this to a little girl online, this worked so instantly in my body, and I was like, this guy's a genius. And when I taught it in my workshop, the comments that were coming through, everyone was like, oh my goodness, I can breathe. It was so clever.
Interesting. And you know, this has been known since 1923, that people, when human beings hold their breath, you can open up the nose. It's not fully known how does it happen, but it's thought that it's activated via the sympathetic nervous system, the stress response. Now, the other thing about asthma then is all physical exercise should be done with the mouth closed. And there's two aspects to it in terms of breathing. One is improving functional breathing patterns, and the other is doing stress or exercise to stress the body a little bit to make adaptations. There's two ways to stress the body. One is to do hyperventilation. So that's a stressor. But if you hyperventilate, then always make sure that you do some breathing recovery so that you balance blood pH, because you don't want to be in respiratory alkalosis. And you don't want to give the idea to the student as well that, you know, we'll bring you in, we're going to stress you, but this is a good way to breathe all the time. It's not. No. So it is good to stress the body a little bit. Physical exercise does it. But we also want to teach you the recovery, to warm down. So one way to stress the body, for example, is hands could be either side of the lower ribs. And you're taking a full breath in through the nose and out through the nose and in through the nose and out through the nose. And a full big breath in and out and in and out. And a full big breath in through the nose and out through the nose and in through the nose and out through the nose and in through the nose and out. So we do that for 20 breaths. And then to take a full breath in through the nose, full breath in through the nose, you're lightheaded there. And this is why we have to be very careful with hyperventilation. And that's only 20 breaths, and we haven't even done 20 breaths. But we typically go in through the nose, out through the nose, and then hold the breath until a moderate to strong air hunger, but then to breathe light for 3 minutes afterwards. There's many people who are doing Tumo type yoga exercises, Wim Hof, etc. The recovery isn't emphasized. And I think it's really important. And there's another thing here we have to talk about. If a person has a Bolt score of less than 25 seconds,
it's not good.
They don't seem to recover so easy.
No.
So we have seen people with a Bolt score of less than 25 seconds that their sensitivity to the gas carbon dioxide increases when they do hyperventilation and breath holding. But people with a Bolt score above 25 seconds, they can cope with it so much better. So that's one example of a stressor. And the second way then to stress the body would be just to do a breath hold, but without the hyperventilation. And we do that with asthma. We don't do hyperventilation with people with asthma.
No.
We do hyperventilation more with sports, with athletes. But not for unhealthy people, because we have to bear in mind what is happening as you're hyperventilating. You're getting rid of a lot of carbon dioxide from the blood through the lungs. As carbon dioxide levels or pressure in the blood is reducing, the blood vessels are constricting, including blood flow to the brain. And also, as during the hyperventilation and you're getting rid of too much carbon dioxide, and this is driving up blood pH, the bond between hemoglobin and oxygen becomes stronger. So hemoglobin, which is the main carrier of oxygen in the red blood cells, don't release oxygen so readily. So that's why it's important that if you are doing a hyperventilation type exercise, understand what's happening, that it's not increasing oxygen uptake in the blood, that it's not causing more oxygen to be delivered throughout the body.
You're blowing off that CO2.
Yes,
yeah,
it's a stressor.
You're blowing off that CO2.
And that's, you know, in terms of the anti-inflammatory response, if you stress the body or if you stimulate the vagus nerve, it can play a role in reducing inflammation. And simply by stimulating the vagus nerve, this has been known since 1998. There's a neuroscientist called Kevin Tracy, And he stimulated the vagus nerve in the rat, and he was able to show it could reduce harmful inflammation. And then he tried it in people with rheumatoid arthritis. And typically now what it's done, it's stimulated electronically with a little device that's implanted to stimulate the vagus nerve. And this in turn then can reduce or block pro-inflammatory cytokines. And these are the cells that are triggering inflammation. And then we have to ask the question, why aren't breathing exercises and humming and gargling and maybe even laughing? You know, of course, you don't want to go too kind of wide, but why aren't they recommended for people with inflammation? Because inflammation, of course, is going to be present in so many different conditions, including asthma, including IBS, including, for example, people with asthma or people with rheumatoid arthritis.
Yeah.
And what's more, breathing exercises can be altered according to the individual, because we can give a little dose of air hunger and a short duration. So, you know, the exercise that we did at the very start, breathing in and out through your nose, pinching your nose for 5 seconds, 5, 4, 3, 2, 1, let go, breathing normally for 10 to 15 seconds and doing it again. We use that for people with the more severe asthma, respiratory complaints, even COVID, so long haulers. And what was interesting, even with COVID, just because it's topical, even though people are, you know, we're all sick of hearing it, I've switched off the news, to be honest with you. I switched it off about a year ago. I hardly ever hear anything now what's going on. And it has been the night, well, I didn't really listen to it much anyway, but in terms of mental health, I think it's very important that people are not just really exposed to so much negative information, because it's not ideal. It can, of course, change your breathing patterns. But coming back to long COVID, Mount Sinai is a hospital in New York, and the doctors there were looking at their patients coming in with long COVID. All patients had low carbon dioxide levels, all of them. And this is where simple breathing exercises could come in to help normalize carbon dioxide in the blood. And carbon dioxide can play some role as well in helping to open up and dilate the airways. And with that as well, nitric oxide from the nose is natural antibacterial and antiviral. And I posted on Facebook an inhaler, a nasal inhaler that's releasing nitric oxide. And nitric oxide is a gas that's administered to babies when they have pulmonary difficulties. It's antiviral, and there is sanitize. By the way, I have no connection, don't know anything about them, but I just find it interesting. We are not hearing about nitric oxide and nitric oxide inhaler. No side effects, and it's been shown. It was published in Pharmacy Times, and when you read it, it seems to be quite effective in halting the virus and slowing it down. Why aren't we hearing about that? You know, it's all vaccines, which is all very well, but some people will want a different option. But why is
it's
this
not even in the conversation? I agree with you. It's because big pharma runs the world, you know. And guys, I'm not anti-vax. I think the people who have created vaccines should be so proud of themselves. They've done incredible work in a very short space of time. But to Patrick's point, it would be nice if, you know, you had autonomy over your own body, and also we were able to learn more about alternative methods. And I mean, what you taught us, this is what's so cool, guys, the little trick that Patrick showed us with blocking your nose and moving your head around, that produces your own nitric oxide. When you breathe in after that, it actually perfuses into your lung tissue. Honestly, you blew my mind when you taught that little girl. You were like, oh, you're swimming. You were so cute with her, because you were like, oh, imagine you're in a swimming pool. And I was like, okay. I turned into 5-year-old Celeste for a second there, and I was like doing it along. And it's just so amazing. The science is so mind-blowing. And you're right. Why is this not in the conversation?
Yeah, I don't know. We had the same conversation, because I know you spoke with James Nestor, and there was a panel of us about, I don't know, maybe about a year ago, not even 6 months ago. And Dr. William Hang was there, Dr. Mike Mew, Dr. John Mew from London, Mark Moeller, AOMT. And the conversation came up, why isn't breathing getting out there? And we were specifically talking about craniofacial development in children. I was a mouth breather growing up. I have a high palate, sleep problems, and it has no question about the changes that you experience growing up in childhood as a result of having your mouth open. You tend to have those changes for the rest of your life. Why was it not being taught by the dental industry? And I wrote about this as well because I feel that the dental industry has so much to offer. Dentists are looking into the child's mouth, they're looking into the adult's mouth, and they can identify these risk factors. They can identify high narrow palate, narrow jaws, smaller mouth, not enough room for the tongue, scalloping on the tongue, jaws that are set back, compromised airway. Dentists can identify this in seconds and say to the patient coming in, go and get a sleep study. Go and get your sleep investigated. It's not happening. And it came up and everybody had their own ideas as to what happened. And I says, I think I tell you why it's not happening. If you teach breathing exercises, you're not going to make much profit out of it. That's why
it's
it's
free
not
and everyone can just do it whenever they want, and there's just no monetary incentive. We were talking about this with James as well. You know, that's why it's not as mainstream.
It is,
yet,
and that's
but I think it's going to change because of you guys.
You could be absolutely sure of this, Celeste. If people knew that they could make a lot of money out of it, you can be
it would be everywhere.
It would be everywhere. That is the reason it's held it back.
Yeah, and that's why I'm so grateful to people. I mean, I'm grateful to James and grateful to you, and you guys are trailblazers, and the information that you're actually putting together is not only free and effective and life-changing, but the way you guys conveyed this information is so easy to understand. They are, like, for example, taping your mouth at night. I mean, it's such a cheap, easy option, and it has such profound impacts into later life. And you're so right, this should just be common practice, and the fact that it isn't is a real shame.
Yeah, like the taping, I suppose, for people who've just heard when you mentioned it the first time, that's always something that kind of puts people a little bit off or whatever. But as you say, there are safe ways to get the lips together. And one of the tapes, like I brought out a tape. Well, I brought out specifically for children that surrounds the mouth because
I saw your Instagram.
We always wanted when a child. I've been working with kids since 2002, and they're coming in with their parents, mouth open, and these children. I'll tell you a study that was carried out in Stratford-upon-Avon, published in 2012, and it looked at 11,000 British children. Children with sleep disorder breathing at age 5. They had a 40% increased risk of special education needs by age 8. Mouth breathing is a contributory factor in sleep disorder breathing. So we know from the kids coming in over the years, kids coming in with asthma, they're coming in with sleep problems, they're coming in with craniofacial problems, they're referred by functional dentists, etc. And we would show the kids how to open up the nose. And the vast majority of kids, we could get them anatomically breathing through their nose. But it's not enough just to open up the nose. Either in the child or adult, we need to change the behavior. And I was getting frustrated over a couple of years because I was saying, okay, here's a child who understands it, who gets it. They can open up the nose, they're breathing, they can improve their breathing patterns, but yet they're still walking around with the mouth open. So we have to get this connection with the brain, and we have to change the neural pathways. How are we going to change the behavior? So I started getting kids wearing the tape during the day, especially when they're under parent supervision, they're watching television, especially when they are distracted. They're on iPhone or whatever they're doing. And it's wearing the tape during the day that's telling the brain that the nose is for breathing. And that was a game changer. We started off with a half an hour a day, maybe an hour a day. And then the Myo tape was developed. It's an elasticated tape that surrounds the lips so the child can talk and the child could drink water, because otherwise we'd have the children wearing a tape.
Yeah, it's not nice for the kids to tape, but that little thing is so clever because they can still talk and do whatever they want if they mouth, but it kind of creates a natural resistance, doesn't it? I thought it was genius. Well done for creating that.
So when the children then, if they forget about breathing through their nose, as soon as they have the mouth open, the tape reminds them, bring the lips together, and we're changing that behavior. And this is funny because I gave a talk 2 years ago in Spain to 150 ear, nose and throat doctors. And I told them my experience, because my nose is all over the place. You'll see there, one nostril is smaller than the other,
You look
deviated
so good
septum
though.
and
You got like
everything. Oh, thanks
perfect
very
face.
much. But I told them and I explained, I said, doctors, you fixed my nose in 1994. Genuinely, they fixed my nose. But I said, doctors, you never taught me how to breathe through it. And from 1994 until 1998, until I read it in a newspaper about the importance of nose breathing, I didn't get the benefits from the nasal operation. Now, I don't think the doctors quite could believe what I was saying to them. And we know that even if you fix the nose, it's not enough. We have to change the behavior. And here's a frightening statistic. Children, the gold standard of treatment for sleep disorder breathing is tonsillectomy and adenoidectomy. The efficacy of it, investigated in 2010, published in the American Journal of Respiratory and Critical Care Medicine. 578 children, only 27% of their children had their sleep apnea fully resolved. 73% of them continued to have residual sleep apnea. But what's more, in another paper, if nose breathing is not restored, despite tonsillectomy and adenoidectomy, there is a 65% relapse within 3 years. Now, I can only feel for the tens of thousands of children who are having adenoidectomy and tonsillectomy every year, no follow-up, no post follow-up, no respiratory rehabilitation, teaching these children to breathe through the nose. It's not enough to just treat the obstruction. We need to change the breathing pattern.
Oh, 100%. And guys, a lot of your questions that are coming through, our interview has already covered. So I know you might have jumped in halfway through the interview. Please watch it from the beginning and actually do one better. Please get Patrick's books. And I would say Oxygen Advantage was a great entry-level book to kind of get you on your way. And then you were saying that The Breathing Cure is your next book, which has literally just been launched. If you're in the UK, you can get it now. Otherwise, in July.
It's actually available worldwide, Celeste, but it's through our websites, oxygenadvantage.com or buteycoclinic.com.
Yeah, can't recommend it enough, guys.
Worldwide.
Honestly, it's such a it's beyond life-changing, and it's free and it's easy to implement. And honestly, guys, it's not just, oh, I'm going to feel a bit better when I wake up in the morning. It's every single physiological process in your entire body and in your brain is going to be impacted by what you do the most throughout the day, which is your breathing.
Yes,
so I'm on your team. I'm on your team. I'm flying your flag everywhere I go, and I just sincerely hope that people get as excited about this stuff as us, because it really is such a game changer. And I wish I discovered this stuff earlier, actually.
Yeah, it's kind of strange, but I think it's because of breathing being taught and reserved for tradition. And I came into breathing just primarily by accident because of my own health issues. And you will find that a lot of people, that's often how they get into it too. You know, our instructors, they apply the breathing techniques for themselves. It's making a difference. And then they want to go deeper and deeper into it. And it is as simple as something as simple as a stuffy nose can have a very abnormal and detrimental impact on that individual. And I'll just show this quickly, right? If you have a stuffy nose, you're more likely to breathe through an open mouth. If you have open mouth, you're more likely to breathe upper chest and faster. Faster and upper chest breathing is agitation of the mind. And even as we spoke about earlier on, Celeste, if we want to think of the inhalation and the exhalation, always think of the speed of the exhalation will determine whether we are stressing the body or not. If we breathe out fast during rest, it's a stressor. So the hyperventilation that we were doing earlier on, breathe in fast, full big breath in and out fast, in and out, or even breath of fire, rapid fast breathing. It's a stressor. Nice little exercise because it doesn't necessarily involve hyperventilation. So you go from a stressor and then a relaxer, you're shaking the autonomic nervous system. Very important for some people, very important. But coming back to it, mouth breathing is a stressor, but people don't have just their mouths open for 5 minutes. They can have their mouths open for 60,
Hours and
70% of
hours
the
and
day.
hours. And
And they're
all
in
through
that
sleep.
constant, yes, all
Oh
the
my
way through
gosh.
sleep.
Sorry,
That's
the doorbell is
50%.
ringing. Keep talking.
You're okay. But 50% of the adult population are waking up with a dry mouth in the morning. And if we want to go a little bit deeper, in a study that was published in the journal Laryngoscope in May of 2020, they looked at 95 individuals with established obstructive sleep apnea. Out of the 95 individuals, and they're young, and I'll say that because they were about my age, 48 to 51 years of age. Out of the 95 individuals, only 35 of them were breathing through their nose exclusively during sleep. The remainder were either solely mouth breathers or switching from mouth to nose breathing. But what's more, their apnea severity was so much greater with the mouth breathing group versus the nasal breathing group. It was double. And the top sleep doctor in the world who coined the phrase obstructive sleep apnea, and he also developed the measurement of severity called the apnea hypopnea index. He spoke about the critical importance of restoring nasal breathing, both during wakefulness and sleep. And I remember I gave a talk in Bordeaux at a sleep conference, and he stood up, he was talking, and he stood up and he said to all of the doctors in the room, he said, doctors, he said, we're talking about sleep hygiene here. And sleep hygiene is, of course, don't look at your mobile phone, make sure your bedroom is dark, and don't be drinking alcohol and all of this good stuff. But he said the elephant in the room is nose breathing during sleep.
Never discussed.
Never discussed. Missed.
I read a book about
overlooked.
sleep recently, and breathing wasn't actually in there, which I think is
Most
actually
of the books, if you read them,
very good point.
you will hardly ever see. But if you dig into PubMed and look at Dr. Christian Guilleminault, you'll see the references to nasal breathing.
Oh, thank you. Listen, I feel gutted that we only have like a few minutes left, but I just wanted to mention to you that all the little comments, I've been keeping a little eye on them, are just people saying, thank you. Thank you, thank you, thank you. You are honestly such a unique and special person. I've watched so many of your interviews now. I'm like a little stalker on the internet, watching you over and over again. And every single time I learn something new, even in this interview, I learned something new. And so guys, if you do ever have, you're cooking some food in the evening, instead of, whacking the news on, go and on YouTube and just type in Patrick Mckeown. You've got so many incredible resources out there, and you've done so many amazing interviews. And I feel so lucky that I got to talk to you personally. It's been really, really incredible.
Oh, of course. And thanks so much for putting the information out there, Celeste. I think yoga could change the world by bringing functional breathing onto the mat and outside of the mat, because it has such an enormous reach, and it's already being done, and yoga instructors and yoga practitioners will get so much out of it, and I'd say don't just listen to me. The best way is put it into practice. And sometimes that's how I really I understood there was something in it. When I had a stuffy nose, I was able to open up my nose. When I started breathing less air, I was able to feel the circulation in my hands.
Yeah.
But I also had a couple of bad experiences with breathing. Before, I was doing an exam at a university, and I always use this example. I was a little bit anxious. It was one of my final exams. And just before walking into the exam hall, I took a walk for about 3 or 4 minutes. And during that 3 or 4 minutes, I took these full big breaths, and I walked into the exam hall totally spaced out. But I didn't realize that the more air you breathe and the fuller the breath and the harder the breath, the less oxygen reaches the brain. I never knew that. If your goal is to improve your blood circulation and your oxygen delivery, you need optimal breathing. It's not about over breathing, but nor is it about under breathing. It's about breathing right. Many of us are in a habit of breathing too fast and too hard. This is not just about breathing shallow. This is about the volume of air we breathe. So don't have the idea that it's good to be taking full big breaths. There is a time if you want to stress the body, but there's also a time for recovery. And I think really, in a nutshell, it's about our everyday breathing patterns. As you say, we carry it with us all of the time.
Yeah,
And
it's the
even
thing you do the most.
it is absolutely.
Yeah, and it's going to have the biggest impact neurologically because of the
Yes.
plasticity.
Yes, totally. And also because of, like, even with, I put in new chapters, epilepsy. And this has been known since 1924 that by increasing blood flow and increasing carbon dioxide, it can impact epilepsy, type 1 diabetes. And I'm not saying that this is a cure-all, but if you were to look at the research by Bernardi for the last 20 years, he was talking about slow breathing for type 1 diabetes to strengthen the bar reflex back in 2001. None of this information is new. So it's about really taking it out of PubMed where people don't have access to it
People
and getting it in
don't.
the hands of the public.
Yeah, that was one of my missions, is to actually bring more evidence-based practice into yoga and the
Yes.
fitness world in general. And it's not easy because I don't really have access to clinical papers. I'm lucky enough now to have an amazing assistant who's in a medical school, and she helps me get papers. But without her, I would be so lost.
Yes.
So I feel like indebted to her, really, you know, because of the access to information. And I think that what your books have done is not only given access to information, but one of the big downsides about clinical papers is they're very hard to read for the general
Correct.
population. And
Yes.
your books aren't hard to read. They're
Yes.
easy to absorb. They're still very scientific. They're evidence-based. And that's really where the magic is, that sweet spot between making something digestible, but still having the amount of science out there to just not bring it into the mainstream is just wild for me. I can't even get my head around it.
Yeah, I think people are too busy. I think people in the healthcare professionals, there are many genuine people. You know that, I know that.
Yeah, totally.
And they have so much stress and not enough support. And, you know, and there is kind of, sometimes I feel that within the healthcare, there's peer pressure, and the peer pressure is on doctors to stay according to this. Don't look outside at anything that may be helpful because other doctors might poo-poo it, you know, that kind of way. So there's always that as well. So there's a few different pressures on different people, but ultimately it boils down to us getting it, and grassroots will make the change. Yeah.
And that's why I just want to again thank you for your time, because I know that you had back-to-back calls all morning and then you squeezed me in. And so thank you so much for that.